morning everyone. My name is Mansi Sanjay Kumar Suryavanshi and my today's topic is CDA and CTA. Confidential Disclosure Agreement and the Clinical Trial Agreement. These two essential legal documents used in context of the clinical trial and research collaboration. They serve distinct purpose and provide a legal framework for the different aspects of the research process. Then first is CDA, Confidential Disclosure Agreement. That purpose is a CDA, also known as a non-disclosure agreement, and it serves to establish confidentiality and outlines the terms under which parties will share the confidential information. Then CDA are used when two or more parties need to exchange sensitivity and the confidential information in the context of the potential collaboration, partnership, or the business transcription. This is common in the various industries, including the healthcare and the pharmaceuticals. Then the content, a typical CDA include the following elements. First, definition of the confidential information clearly specifies what information is considered confidential and subject to protection. Then second is obligation of the parties, outlines the responsibilities of the disclosure parties and the receiving party in the protecting and the using confidential data. Then third is duration of the confidentiality. The species how long the obligation of the confidentiality will last. Then the permitted disclosure, and the last one is the consequences of a breach. Describe the action and the remedies. Then use case. In clinical research, a CDA might be used when a pharmaceutical company wishes to share the appropriate information about a potential drug candidate with a researcher institute or the contract research organization while exploring the possibility of collaborating on the clinical trials. Then second is a CTA. Means clinical trial agreement. The purpose of clinical trial agreement is a legally binding agreement that outline the terms and the condition governing the conduct of the clinical trial. Then use CTA the CTA are the crucial in the field of clinical research and are used to define the rights and responsibilities of various parties involving a clinical trial, including the sponsor, investigator, and the participant instituent. Then content, a typical CTA include the following components. First is study protocol, details in that the details of objective, design, and the procedure of the clinical trial. Then second is the financial term that covers the topics such as funding, payment schedules, and the budget allocation of the trials. Third one is roles and responsibilities that defines the responsibilities and obligations of the sponsor, investigator, and the institute conducting the trial. Then fourth one is the regulatory compliance that ensures the compliancing with the applicable regulatory requirement, including the submission of the clinical trial data to the regulatory authorities. Then next one is the adverse event reporting, outlines procedure for the reporting and the managing the adverse event that occurs during the trials. And the last one is the data sharing, addresses data sharing and the confidential related to the clinical trial data. Then use case, in a clinical research, a CTA is used when a pharmaceutical company or the sponsor collaborates with the investigator and the instituents to conduct the clinical trial, and it defines how the trial will be conducted, who is responsible for various aspects, and how financial matters, data, and result will be handled. Thank you everyone.